Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment. People like to hear about themselves. And the goal for you is to figure out what their problems are, address it, let them talk it out, and deliver the solutions. Always remember that we have 2 ears and 1 mouth, meaning that we should be listening more and talking less. In the presentation phase, if you talk more, you as a presenter, you as a marketer, that means you lost. Whoever talks more loses. Pretty much, we want them to talk more. So technically, when that game happens, they lost and we're getting referrals. So I just try to share some analogies here and there of what you guys should actually know and what you guys should actually be dealing with. Now, during your presentation, during the whole presentation that you're doing, okay, we just talked about right now what the problems are facing. If you can solve those problems, if you can educate themselves on what you're doing can solve those problems, that's what's going to be able to make you stand out. Now, all throughout your presentation, you should have what they call closing techniques, right? Now, there is a separate, there's going to be a separate process in the whole sales process called closing. That's pretty much right after the presentation stage. But even during presentation, you should be including some closing techniques in there. Like, for example, here's a great tip. Before I even start my presentation to a physician, for example, I usually use the referral close. And so we have hundreds of these type of closes that you should have, scripts that are already written out that you should incorporate into your training, into your marketing. So I'll ask something like this to the physician. Hey doc, before we get started, before we even get started with this whole presentation, who do you know that may want to use our services for their patients? Right? That's a referral close. I'm literally trying to find out, can the doctor refer me to somebody else? It's just a nonchalant question, just trying to jump in, this little, shooting the breeze type of stuff. And if the physician says, well, I don't really have anybody right now, that's perfectly fine. Hey, great, thank you so much, doc. But guess what? If the doctor says yes, that he does, get the information. It's called a referral close. Now you can go to that person and do a presentation to them and say, hey, Dr. Kim sent me over here and said that you would probably value our services. Is it okay if I take a few minutes of your time to talk to you about our company and how we can provide care for your clients? Hey, now you're starting a new thing. But guess what? Dr. Kim recommended you to them, so they're going to pay more close attention. It's like, for example, one of your friends telling you about this great, amazing restaurant that they just went to. They're going to share with you guys everything that happened. It's going to make you want to actually go to that restaurant as well if you trust your friend. So that is one of the referral closing techniques you should be able to have. Now, here's another one that you should incorporate during your presentation and a little bit in the beginning process, right? And once again, I'm giving you guys scripts. These are things you should incorporate. So this is called the decision maker close, right? How does the decision maker close goes? Before you even start, hey, other than yourself, are there anyone else, that in this company that needs to be in this meeting that's going to be able to make a decision for the patients? And the reason why we're asking that is because sometimes you might find out that the person you're presenting to is not the only one making that decision. So guess what? If there's 2 social workers, maybe you can have that person in there with you as well. That's going to be able to be helpful, right? I sure as hell would want to be able to speak to everyone that's going to be able to make the decision here. So incorporate this into your whole sales process, into your whole presentation process. The next thing is, go over the programs. When you find out, what helps them, go over your diabetes program, right? So we provide a diabetes care program. So these are the steps that we do when we have a patient with diabetes. We send them a nutritionist because that's covered by Medicare. If you have a cardiac program, what are you guys doing? We offer these type of services. We have we have a nutritionist, we have a diet, we have a medication. We'll speak to the doctor. We'll work with that. Those are important stuff. PTI&R program, right? PTI&R is such an amazing thing. There's PTI&R machines. Most patients are being sent home are in blood thinners, right? They may be taking Coumadin because they can't afford the more expensive blood thinners that's going to be able to help them, right? So because if you're taking Coumadin, you have to get your ProTime and your INR tested to be able to make sure that your lab levels are correct to be able to take the right Coumadin dose, okay? So a lot of agencies, A lot of agencies that I see now have these. They have the PTINR machines that their nurses have. So what we're going to do is we're going to tell the physician, hey doc, just to let you know, we have our own PTINR machines. It is, the right type of machines that are not having problems right now, and we can actually get the PTINR results right away. Because a lot of physicians, they hate getting that call at 4 o'clock in the afternoon, because typically if you have a patient that gets their labs done in the morning, you won't get the PTINR results till the afternoon. And here you are trying to get the doctor to give you a new order for Coumadin, but guess what? By the time he gets you the order and you order from the pharmacy, it might take a little bit longer to get to the patient, and now all of a sudden the medication's out of whack, right? So if you're saying that we have a PTINR machine so we can actually get you the results right away, that right there is going to be able to be helpful. But here's the thing, don't rely on your nurses to actually do the PTINR, right? You can actually have somebody in charge of that. You can say, hey, PTINR today, go ahead and send an LVN, an LPN, a little bit cheaper. Brought to you by our partners at HomecareAnsweringService.com and MedicationReminderProgram.com. So MedicationReminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, HomecareAnsweringService.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have HomecareAnsweringService.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.